My name is Brianna Stein, and my topic is biceps tendinopathy. So first, just a few definitions. Tendinopathy is just kind of a general term for like a tendon stress syndrome. And then tenosynovitis is basically just the inflammation of that synovial sheath around the tendon. And then tendinonesis is microscopic tears of the tendon caused by repeated trauma. So just a general anatomy, you can look at the picture on your handout. I focus in on the long head and the proximal area of the biceps tendon. As we know, the long head attaches from the glenoid labrum to the supraglenoid tubercle, and it runs through our bicipital groove. And then the proximal portion has an extrasynovial sheath that is covered by the synovial sheath, and it has an interarticular structure. The biceps tendon is stabilized by a pulley system, which consists of the superior glenohumeral and coracohumeral ligament, and then also the transverse humeral ligament, which consists of the subscap and the supraspinatus muscles in the bicipital groove. So, mechanisms of injury for a biceps tendinopathy typically is due to an abrasion of the tendon in the groove, and normally it comes because of rotator cuff dysfunction, overuse of the biceps muscle, or impingement. One of my articles talked about the hourglass bicep, which basically how it sounds is what it looks like, which is when there's an entrapment of that tendon, which is kind of bigger. And then also biceps tendinopathy can lead to where the biceps tendon can rupture, or it can lead to posterior capsule tightness. And then it can also be related to anterior shoulder instability. So signs and symptoms of biceps tendinopathy can be, just typically it's going to be pain, and that pain is going to be really deep and throbbing in the anterior shoulder. It's going to be localized in the bicipital groove, and it may radiate towards the insertion of the deltoid muscle. It typically will worsen at night, and it's going to be during the throwing motion they're going to have pain. And then also as you're like evaluating, you can feel like a snap when you're doing range of motion testing. And then diagnosis of it, there's not really any specific special tests for it, but you can use special tests for impingement or slap lesion like Yergason's, Meyer, Hawkins, or Speed, because normally if you have impingement or slap lesions, it can lead to the tendinitis. And then if you really have to, you can do an MRI, an ultrasound, or an arthroscopy just to confirm it, but normally you don't want to have to do that. And then treatment of it is typically just conservative. You can take anti-inflammatory drugs. You can also just ice, rest, or just doing physical therapy to like strengthen the muscles. One of our studies found that you can do iontophoresis has helps with it, and then also corticosteroid injections. And then typically you don't want to do surgery, but if the conservative method like fails after about 3 months, is what my study said, then you're going to move to surgery. They talked about a couple ways that you can do the surgery, which is tendinotomy, which is what we talked about in class, how they just completely cut the biceps tendon from the attachment at the shoulder joints, or there's tenodesis, which is where they cut the biceps tendon and then they reattach it to your humerus. And then just kind of what they typically do in the surgery is they will do a removal of the synovial sheath, and then like release it, and then they can do debridement for those who have like the fraying, and then they can also reconstruct the pulley system. Any questions?